Hello, this is Hannah Burks, and I'm in your Teal 859 course, and I'm here to discuss autism spectrum disorder. I'm going to give you a little forewarning if you hear any background noise. I'm on my honeymoon, and so my fiance's in the house doing some things. So, autism spectrum disorder. Important notice is every individual is different, and so as I talk about autism spectrum disorder in this PowerPoint, need to be reminded that no individual is the same, and so there are many different characteristics and behaviors that will be discussed, but not every individual has all of them, nor should we expect every individual to act the same way regarding whatever behavioral issues or emotional issues they may face. Characteristics of students with autism spectrum disorders. They can struggle with social interactions. They may avoid eye contact. They might prefer to be on their own and prefer not to socialize with their peers. They might be the ones that kind of would rather be hidden in the corner than be present, talking and intermingling with their classmates. They may struggle to say how they really feel. They may struggle to share their emotions respectfully, and at times these struggles to display emotions effectively may come out in anger or some severe form of rapid change. They're slower at learning how to talk or move. They may have delayed ability to learn concepts. Might overreact to something that they dislike and may have many different emotional responses. Some categories within autism spectrum disorder is ADD, ODD, specific learning disabilities, ADHD, OCD, Tourette's, gifted, auditory processing, depression. Those are just to name a few. So there are many different characteristics of autism, and we definitely can't place a student in just one area because every student is individual, and we need to learn how each student ticks. Social relationships. Students with autism struggle to socialize with their classmates. They often feel uncomfortable around certain individuals, which could cause them to tick in a different way around one student than another student. Their tone of voice and their body language could be part of the issue. Um, I remember listening to a video about a woman whose child had autism, and she said that her son really struggled in school because he hated math, and his teacher had a very squirrely, like a very high squeaky voice. And even though that's not her problem, it irritated the boy. And so whenever it was time for her to tell him that they had to do math, he just would blow up. And so she mentioned how at one point in time he got so upset that he said this little like fourth grade autistic boy said I would that said that he would bomb the school. And so the teacher obviously sent him to the principal's office, and he got stuck there all day. And so what he associated in his head with is if he said, I'm bombing the school, the teacher would make him leave, and he would no longer have to do math, and uh, he'd no longer have to be around her voice. And so he continued to say these things. And so the parent eventually advised the teacher to ignore it for like 3 days, and after 3 days, um, it should go away, and it did. But that's just an example of how different voice tones and different body language and just different relationships affect students with autism differently. Communication. Generally, they take longer time to speak. They're over a year old and are still not speaking. They might express the need or want to talk to individuals and are just fine on their own. Their body language is hard to understand. So some ways that we could practice communication, in some ways therapists practice communication with students with autism is by having these little boards that have a sticky Velcro on the back. And so when they have to complete a task or when they want to do something or play with something, they would move the sticky um, onto a different location saying that they're going to be doing that activity or they're going to do this thing or I'm feeling this emotion but I can't explain it well enough. So the student with autism would grab the specific card that might say he's upset or something, and he would stick that on the Velcro. And so that way the teacher got the point, the student got the point, and they could possibly prevent overreactions from occurring. Student interests. Students with autism are honed in on a specific area of interest. They're very intelligent in that area. They might not care about other interests, but their favorite thing is definitely by far something that they know more of than anyone else. And they strive to know more about that. And they love hearing conversations about their favorite interests. They're not necessarily interested in the same things as their peers. They get very irritated when doing projects that the student isn't interested in. So, like I just explained, that student didn't like math, and so he got very upset because he had to do math. And so um, it can be very hard to transition from something they really enjoy to something they need to study and practice. Um, and so that can be hard for teachers. Doesn't seem Autistic students sometimes don't seem to enjoy other peers' interests, but would gladly discuss their area of expertise in a lot of detail. They like to do many things that they're specialized in because they have taken the time to learn about it. So these students just really love their topic and really want you to know about it. So that's what's really cool too, is if as teachers we could figure out what their interest is and use that to help them learn in an area that they're not quite as happy to be working in, how maybe we can slide the transition a little easier and help the student desire to learn because it has to deal with their specific topic of interest. Student stress. Students with autism spectrum disorder struggle to handle stress. They have higher levels of stress than those of their peers. They're easier to get stressed. They struggle with transitions between classrooms. They need a little more advanced notice that they're going to be switching to a different topic than a regular student because they need to know in advance how to best prepare themselves for the upcoming transition. They also may experience anxiety and depression. These students uh, get overwhelmed very easily, and so it's best at times to focus on more simpler ideas and to try to help prevent their anxiety and depression from skyrocketing. The diversity of students with ASD. So, students with ASD have three different levels of support, and every student who has ASD is different. Multiple approaching must be made in order to find the right strategy for each individual. The amount of physical, social, and emotional stimulation varies based on the individual, and so some students will have a very easy time comparative to other students with ASD interacting, and some might struggle to even sit in the same room as other kids and enjoy it. Instructional supports for students with autism spectrum disorder. As I explained before, a little bit, these pictures on this PowerPoint slide show different activities and different things, and so a student with ASD would have these, and so um, they could move the Velcro piece of cardboard square or paper square, whatever that is, um, over to the other Velcro piece and to show that they're going to be doing this activity. And this proves very beneficial for them to help transition from one activity to the next without maybe getting quite as upset. And that computer is very outdated on that picture. um, Responding to behavior. Um, this can be very difficult to cater the needs of specific students in the classroom. As I mentioned earlier in the example of the student with ASD whose mom had talked on the video about him saying he would bomb the school, and the teacher just had to ignore him saying it for 3 days, and then eventually he stopped saying that to get out of math and to get out of, yeah, just hearing her voice and everything. Obviously, I don't know how she was able to completely do that because I'm sure that can be difficult um, to be able to ignore that student doing it, but also tell all the other students that they're not allowed to behave and respond the same way. And so that can be very difficult and it's not really fair for the other students. So the other students may act in a similar way because they might not understand why the other student can, but they cannot. Um, they um, need to be responded to in a calm manner, and we need to try to understand what caused their frustration and find the tick, as well as limit it and allow a student to prepare for what's coming up. If the tick cannot be eliminated, so they have time to cope and understand what's going to happen next. Fostering social interactions. This promotes the student with autism to spend time around the students that they socialize with the most, which might allow them to work together to accomplish goals and help the student not feel alone, but also not feel overwhelmed with other socializing with others. So this allows the student to um, just be more comfortable as they're trying to complete daily tasks and can do it with their friend, which is very encouraging um, for students who struggle with relationships. So we could encourage the student with autism and their friend to face these social challenges together and whatever other struggles the ASD student may be having. Communicating with students, we need to keep the task specific, give them one task at a time, and wait until they complete that task in order to move on to the next step. So they're not freaking out because there are 5 different instructions and they can't remember which one's in what order. They don't want to ask their friend because they're nervous. Um, yeah, just by giving them one task at a time helps them focus and not stress about the future. Um, Avoid going too far in depth on the process because that can overwhelm the student if there are too many tiny instructions within. And they also may have difficulty understanding the emotion behind a question. So avoid sarcasm or giving emotions vaguely and not explaining how you're feeling. But if you tell an individual how you feel and you encourage them to tell you in words how they feel, that might also help the student with ASD to understand that you care about them, um, even though you know it's hard for them to socially interact with you. So, and now here's my works cited, and I hope that you have a great weekend, and thanks for your time. Bye.